I believe this is quite interesting work because one issue in ALS is our inability to predict exactly the progression of patient. And there are several prognostic models, actually. Some of them are really recent, but most of them use the clinical trial data or use just data at diagnosis. So what we aim to do was to use real-life cohorts and try to predict the prognosis not only from diagnosis, but from any point during the disease course. So we use the data from 6 centers, 4 in Italy and 2 in Israel. And we applied a particular algorithm, a particular analytic technique, which is called dynamic Bayesian networks. So Bayesian networks are an algorithm able to build conditional probabilities among variables, and dynamic Bayesian networks just take into account the possibility for some of these variables to change in time. It's quite complicated, and the intermediate result is a graph, a so-called graph in which points and arrows just connect each other. Quite complicated actually to read, but the more important things was that we set as primary outcome the survival, so death or tracheostomy or censoring date. And we set as secondary outcomes the loss of autonomy in some domains defined by the Milano-Torino staging scale. So walking, swallowing, breathing, and speaking. And we looked at a patient. Actually, this is quite is a little bit tricky because we divided our data set in a training database and in a set database. We applied our database, the dynamic Bayesian network, to the training dataset. So we built this graph, we built this model, and then we applied this model only to the first visit of the test dataset. And so in order to predict their evolution, and then we compared the predicted evolution with the real evolution, because these patients were retrospectively followed up. So we had this data. And we saw the concordance of the prediction and the real evolution of these patients at periodic intervals. For example, it was about each 12 months. And what we saw is that our model was actually really accurate in predicting this evolution, because the concordance was almost always less than the discordance was almost always less than 5%. So in the end, in conclusion, we developed a model able to predict the progression of ALS with a good accuracy, we believe, and not only from diagnosis, but from any point, and not only with respect to survival, but also with respect to the loss of functionality in many domains. And we aim to put this in the future, to put this model on the website, but just for physician at the moment.